You can't get the flu from the flu shot. You can't get COVID from the COVID shot, and you can't get RSV from the RSV shot.
Every single patient that I give a flu shot to, I say, thank you for protecting yourself, your family, and your community. And it isn't just platitudes. I mean that very sincerely, because a community is healthier and safer with people vaccinated.
Hello, and thank you for listening to the Howard County or HOCO Health Podcast, a podcast produced in collaboration with the Howard County Health Department and Howard Community College, where we discuss topics on all things public health. I'm Howard County Health Officer Dr. Maura Rossman. During today's episode, we're talking about something that affects all of us: staying protected from respiratory illnesses like flu, COVID-19, and RSV, also known as respiratory syncytial virus. Every year, these viruses send thousands of people, including children, to the hospital. And what many people don't realize is how much protection we can get simply by keeping up to date on vaccines. Today, I'm joined by Howard County Health Department Immunization Nurse Supervisor Will Doyle and Assistant Nursing Director Erin Anderson, who are here to help us understand why vaccination remains one of our strongest tools for keeping both children and adults healthy. Our first guest is Will Doyle. Will is our Immunization Program Manager. Thanks for joining us today, Will.
Thanks, Dr. Rossman.
Respiratory illness season is upon us, and we are seeing an increase in illnesses, which will likely continue as we move into the next several months. Can you share why it is so important for both children and adults to stay up to date on vaccines for respiratory illnesses like flu, COVID-19, and RSV?
Sure, I could go on and on and on about that, but instead I came up with a succinct 3-point summary, and it's even alliterative. The reasons you want to stay up to date are seasonality, severity, and subvariants. For seasonality, we know every year as we get into October through March, we're going to see increases in flu activity and other respiratory illnesses. If you just look at patterns of behavior, kids going back to school, so they're in that crowded environment, travelers passing through busy hubs like airports for the holidays, people gathering for the holidays. It's a situation where these respiratory illnesses can spread much more quickly through a population, and they do. So that's one of the reasons we want to stay up to date on vaccines for these illnesses. I mentioned severity as well. There is a misperception, and I'll admit when I was younger, I used to think that flu isn't that big a deal. You just treat the symptoms, you get through it, and things bounce back to normal. But flu can be very severe for many patients. This past season, 2024 to 2025, was the second highest number of pediatric flu deaths recorded in the last 20 years. In 89% of those kids, there were 280 total, 89% of them were not fully vaccinated for flu. Flu and RSV are very serious for kids. Also, older adults can be affected by them. Seniors account for the majority of hospitalizations related to flu. And so for that reason, flu being just so severe for many patients, it's a good idea to stay up to date on your vaccines. And then I mentioned subvariants. Flu and COVID are a couple of those pathogens that evolve constantly. So every season, it's important to stay up to date. If you got a flu shot a year ago or 2 years ago, it isn't going to protect you this season. So it's important to stay up to date with the most recent formulation so that you're protected against whatever bug is out there circulating.
I'm so glad you mentioned the point about kids and how bad the flu season was last year for kids, because many families do think that children in general don't have very severe illness. And in general, people also think that vaccines are just for kids. And you mentioned that severity can be particularly impairing for older adults. There's lots of different vaccines, flu vaccines out there, and respiratory vaccines. Can you describe a little bit more about who should be getting what vaccine?
Yep. We'll go just for the illnesses that we're focusing on for this podcast, one by one. Let's start with flu since we are in flu season. Flu vaccine is recommended for anyone 6 months and older. There is a preferential recommendation for individuals who are 65 or older to get a high-dose flu vaccine. High-dose flu shots aren't associated with any worse side effects compared with a regular dose flu shot. It's just a higher concentration in that dose, so it gives you a better immune response. As we get older, our immune systems weaken, and so it is important to give a little extra boost to individuals in that 65 and older group to make sure that they're best protected against flu. Flu shots are safe during pregnancy. In fact, there are studies showing that antibodies are passed along to the baby, so that's a great way to protect everyone in the population, particularly considering that there's a minimum age of 6 months to get a flu shot. So that's a good way to protect very young patients. So those are the main points about flu and how most of the population, aside from those younger than 6 months or someone who has a known severe allergic reaction to the vaccine, everyone else should be getting a flu shot every season. For COVID, it is approved for 6 months and older and is recommended as a routine vaccination. Moderna Spikevax is a particular brand that goes all the way down to 6 months. If your provider has Pfizer, that's a minimum age of 5 years. So you might want to check around if you have a child in that younger age group, younger than 5, just to find someone who can make that Moderna dose available to your child. So that COVID vaccine, similar to flu, recommended for 6 months and older. And then for RSV, we'll talk about the two segments of the population that are most vulnerable to that, who have recommendations for the RSV shot. That is very young patients, babies, newborns whose mother did not receive the RSV vaccine during pregnancy. So if a child is in the first RSV season between October and March, I just came out of an appointment in our immunization clinic, and so we screened the patient there to see if they were eligible for the RSV vaccine. In a lot of cases, parents respond that mom did get the RSV vaccine between weeks 32 and 36 of pregnancy, between the months of September and January. So that's another group aside from newborns and the elderly. You can protect baby from RSV by getting the RSV shot during pregnancy. But if the timing wasn't right, or for whatever reason you weren't able to do that during pregnancy, then your child can get RSV in that first respiratory virus season. Besides pregnant persons and babies getting RSV vaccine, we want to think about older adults. Specifically, there's a universal recommendation for 75 and older to get the RSV vaccine. And then for the segment of the population that's 50 to 74 years old with certain risk factors like chronic underlying health conditions, they're recommended to get RSV vaccine as well.
That's a lot to take in. And just as a reminder, if our audience hasn't remembered everything that Will just said, you can always go talk to your provider, ask questions about which vaccine may be best for you and other members of your family. Will, you mentioned immunity and immunologic aspects of the person's health, of why they may be more at risk for respiratory illnesses and why vaccine is important for them. I've heard from some people about natural immunity and the feeling that, well, these viruses are around and my body will take care of it, and vaccines, maybe I don't need vaccines, or I got vaccine a year ago. What do you say to people that want to know more about either natural immunity or about their own health, immune system, and the importance of vaccines and why these vaccines work?
That's a really good point, because I've heard that argument as well. During a clinic appointment, there might be a little bit of give and take, just figuring out, what is the right approach. The way that I think about it is I have the choice of getting a shot to protect me against flu, for example, or possibly having flu. I've had a lot of patients that I've seen in clinic this season, and they've told me specifically they're getting their flu shot because they had flu last year, and they'd much rather roll up their sleeve and deal with a jab in the arm, a little bit of muscle soreness for maybe a day or two, and then they're back to normal and they're protected, than being out for multiple days with very severe flu symptoms. So you can choose how to get protected against illness, either by being infected with it and developing a natural immune response, but that might come with some severe symptoms, possibly even hospitalization. So that's the choice that you have to make is, do you want to roll up your sleeve and get the shot, or do you want to roll the dice and possibly have a really unpleasant experience being ill to have that natural immunity? Every single patient that I give a flu shot to, I say, thank you for protecting yourself, your family, and your community. And it isn't just platitudes. I mean that very sincerely, because a community is healthier and safer with people vaccinated.
Yeah, I agree. The other aspect too about vaccines, the type of vaccines we're talking about today, is that they can also help an individual from spreading it to somebody else who may be immunocompromised, or a newborn baby, or an elderly relative.
You have you're avoiding learning loss due to kids being out of school for multiple days. You're avoiding lost productivity, missed deadlines. And a lot of people are in a situation of not having sick leave. And so if they have to call out, they're not going to get paid. So just in terms of, your household finances, what your professional goals are, what your academic goals are, or what goals you have for others in your family, it makes sense to protect yourself, because thereby you're protecting everyone else in your household.
We're going to take a break right now, and I want to continue the conversation with our next guest, Erin Anderson. You're listening to the HOCO Health Podcast, where we talk about all things public health. Today, we are talking about respiratory illnesses and getting vaccinated to help protect against severe illness, hospitalization, and even death. Our next guest is Erin Anderson. Thanks for joining the conversation today, Erin.
Happy to be here.
As you know, we have been talking about the benefits of vaccination against respiratory illnesses. There's been a lot of talk about the safety and effectiveness of vaccines. And I know you, like Will, are very passionate about vaccines and getting vaccinated. So for people who may be hesitant or unsure about getting vaccinated or having their family members vaccinated, what would you tell them about the safety and effectiveness of these vaccines?
I really like this question, and it's one that I think about a lot. So I think the most important thing when you're talking to patients, especially as a healthcare provider, about safety and efficacy of vaccines is to, first of all, acknowledge people's fears without judgment. That can be really important in creating that good relationship between a patient and a provider. So you want to start with honesty. And the honest answer is that no medicine, no vaccine is completely safe, and no medicine, no vaccine is completely 100% effective. But the problem is that we always, as a society, overestimate the risk of a vaccine injury, and we're really underestimating the risk of an injury from the disease itself, like Will was mentioning in the first part. The risk of a severe adverse event from a vaccination is about 1 in a million. And that's a really hard number for our brains to wrap around, so I'll put it in a little context for you. The risk of it getting struck by lightning is about 1 in 15,000. So I'll spare you the math, but that means that you are about 65 times more likely to get struck by lightning than you are to have a serious reaction to a vaccine. And if we want to put that in context of vaccine versus actual disease, let's talk about the flu virus. So last year, like Will was mentioning, it was a pretty bad flu year. The hospitalization rate for the flu, so getting hospitalized for the flu, was about 127 people for every 100,000 members of the population. That's a little bit higher than a standard year, but it's usually pretty close to that. So again, I'll spare you the math, but you're about 12 to 1,300 times more likely to be hospitalized from having the flu than you are to have an adverse reaction to the flu vaccine. So to me, those numbers are really in favor of helping me to understand those risks. Pretty small risk of a vaccine injury, pretty high risk of comparatively for having a hospitalization from the disease that vaccine is designed to prevent. The other thing I really need to emphasize to all of our patients is that vaccines as a medical intervention are literally the most studied medical intervention we have. There's over 100 years of research about vaccine safety, about vaccine efficacy. They are rigorously tested for safety and efficacy before they're even allowed to be on the market. And then we have several safety monitoring tools that we use both in the United States and worldwide to continually review vaccine safety once they're on the market. So we have tons of mechanisms in place to study these vaccines, and there are thousands of studies involving millions of people that show vaccines are safe and effective. In the end, hesitation to vaccinate comes from fear, which is valid. You're afraid for yourself and you want to protect yourself and your loved ones. And as a healthcare provider, I also really want to protect myself, my family, and my loved ones, and my patients and my community. And that's exactly why I do choose to vaccinate and why I do strongly recommend vaccination to everyone.
I think one of the things that's happened over time with the success and effectiveness of vaccines is that people no longer hear or see about the terrible adverse impacts of getting the disease. I do remember taking care of infants and young children in the pediatric ICU who had severe flu, severe RSV, and other vaccine preventable diseases that new trainees and new pediatricians have never seen. But unfortunately, we've all heard about outbreaks of certain diseases that we are now seeing that we used to not see because folks are not getting vaccinated, and that herd immunity that Will talked about earlier has become too low to protect the population at large. So yeah, it's all about risk benefit, but I understand how it is hard for some folks to see the risk when it may not be visible to them. What are some of the misconceptions people seem to have about these vaccines? I know we're talking a little bit about that. And what would you say to address that? And where might people seek out resources or more information should they want that?
There's a ton of misconceptions about vaccines, especially these flu virus or the flu vaccine and COVID vaccine that we try to get everyone to get annually. And, I think that the blessing and curse of our availability, internet news, things like that, you can get a lot of good information and information spreads really quickly, but you can also get a lot of bad information and bad information spreads equally quickly. So I think one of the main things that I hear about, especially like flu vaccine, COVID vaccine, is, well, the vaccine is going to make me sick. And again, leading with honesty, it's definitely true that you can have some side effects, especially with the COVID vaccine. That one tends to have more of those systemic side effects like fever and body aches and fatigue, especially in that 12 to 48 hours after vaccination. That's true. It can make you feel kind of crummy for a little while. Usually not with the flu vaccine. That's generally more of just the pain and swelling in the arm. But when you have those side effects, it's important to remember that those are actually kind of a good sign that your immune system is mounting a good immune response to that vaccine so that you can effectively fight off any future infections. Those two vaccines that I was talking about just now, flu and COVID, they are designed really differently, but neither of them is capable at all of giving you flu or giving you COVID. The most common flu vaccine that we have contains 3 different varieties of the virus, but they are all killed and they're not able to replicate. And then the COVID vaccine contains, it's basically like the instructions for just a piece of the virus. I like to use an analogy of a bicycle. So for the flu vaccine, if I handed you a bicycle that had been run over by a semi-truck, the frame is bent, the handlebars are broken, your brain would still recognize that as a bicycle, but you wouldn't be able to ride it. It wouldn't get you anywhere. For COVID, it's like if I gave you 1 page of the IKEA instructions for that same bicycle, and that was for the handlebars. Your brain would recognize, hey, this is going to make a handlebar. I know that's an important part of this bicycle, but can you ride that handlebar? No. And you can't even make the rest of the bike with the instructions that I've given you. So neither of these viruses or vaccines, can cause the virus that they are preventing. Another thing that I hear commonly is, oh, I don't need it because I'm young and healthy. And I will be honest and say that in my early 20s, I definitely made that statement. But I have learned a lot since then, and now I am singing a different tune. So it is very true, like Will was saying before, for flu, for RSV, for COVID, the most at-risk populations are some of our very young and our older adults. But they are all contagious diseases. They can all have serious complications like pneumonia or encephalitis, blood clots, heart problems. And these risks do exist for everyone, including otherwise healthy adults. So it is important to continue to vaccinate to protect yourself. And then again, like we talked about, you might be 30 with no health problems, but what about your infant nephew, your neighbor who is elderly, or your colleague with type 1 diabetes or some other type of immune suppressing disease that could make them a lot more at risk? So like we've talked about a couple times so far, we are a community. We protect ourselves, but we also need to protect each other. And that is kind of why I say, even if you're young and healthy, let's still vaccinate. And then finally, one of the ones that I hear a lot is, especially with the flu vaccine, it's not even that effective. Why would I get this vaccine? And again, lead with honesty. It is true that the flu vaccine on any given year is between 40 and 60% effective at preventing you from getting the flu at all, which might not seem high in comparison to some other vaccines. But we've also talked about it does reduce your risk significantly of hospitalizations and death if you do get sick. So we are preventing those long-term side effects. Like Will said, we are preventing the loss of time from work, the loss of time from school, the spreading it to other members of the community. All of these things are really important and important to think about when you're considering whether getting vaccinated this year.
I love the analogy to the bicycle. I hadn't heard that before, but I'll add another bicycle anecdote. I guess for me, it's like wearing a helmet, right?
Exactly.
I'm not going to crash. I'm a good bicycle rider. Why do I need to wear a helmet? I like, the feeling of the wind in my hair. But the reality is I could fall. I may fall. And especially if I'm older or younger, that may have a significant impact my overall health. So wearing a helmet seems like a pretty reasonable idea. And even
adding that to mine. I'm adding that to my analogy from now on, Dr. Rossman.
And even, talking about, I have heard, particularly the flu vaccine, right? Oh, it's just not really a good match. I may get flu anyway. But let's just say someone has said, I have a lottery ticket and you have a 60% chance of winning. I'd be, hey, I'm on it. Right? Because There's really no downside. I do get your arm may hurt a little bit, but you will recover pretty quickly at that. And who knows, you may win the lottery and not get the flu, not go into the hospital, not get anyone else sick. So, yeah, totally agree with that. And thank you for talking about all those misconceptions. You can't get the flu from the flu shot. You can't get COVID from the COVID shot. And you can't get RSV from the RSV shot. In addition to getting vaccines, because they're just one tool to preventing respiratory diseases from spreading, what are some other effective steps people can take to help prevent the spread of illnesses in their homes, schools, and workplaces?
The recommendations that I'm going to give are not fun and they're not flashy, but they are effective. So vaccines, like we've been talking about, consistently rank as one of the top 5 public health achievements of all time, but so does improvement in basic hygiene. So the easy answer is wash your hands, cover your cough, wear a mask if you're symptomatic and you have to go out in public, and most importantly, stay home if you are sick. It is easy as that.
Things we learned in kindergarten, or I think now the kids learned in pre-K or even younger. Hand washing, cover your cough, and sneezing into your elbow. Stay home if you're sick so you don't spread it to other people, and it gives your body a chance to recover. We've been discussing respiratory illnesses and why people should get vaccinated to help prevent serious illness or worse. For both of you, let's talk about actually getting the vaccine and the future. How can communities prepare for respiratory illness seasons And what part does vaccination play in that preparation?
At the health department, because we know, I mentioned seasonality before, we know that flu will be a problem this time of year. Every season, we offer a slate of community flu events, completely free, no appointment needed, usually getting started in early October. So when we get to the end of the summer and the early fall and you're looking for your flu shot, just check the health department website, because we will have more than a dozen events probably where you can just show up during that window and with a very short wait and just filling out a little bit of paperwork at no charge to you, you can get flu shot to protect yourself, your family, your community. We also have left over from that immunization campaign, since all of the events have wrapped up at this point. We do have high dose flu vaccine left over for individuals 65 and older. Supplies are limited, but if you are 65 or older and you haven't gotten your flu shot this season, you can come to the health department. Again, no appointment needed, just a walk-up encounter to get your high-dose flu vaccine. But that is limited to its 65 and older population based on the approval for that vaccine.
Yeah, the retail pharmacy stores, grocery stores are available, particularly flu and COVID vaccine. And usually they accept all insurances, so there is no fee. Last question I have, because we are running out of time. Is it too late to get vaccinated for any of these respiratory illnesses?
No, it is not too late. We talk about getting vaccinated. We vaccinated last year through April, I think. We try to vaccinate before peak flu season starts, and peak flu season usually starts around late December, early January. We want to get vaccinated a little before that so that our bodies can be appropriately responding to that vaccine before those viruses peak. But it is never too late to get vaccinated. We really want you to get vaccinated before, during the respiratory virus season.
Yeah, and just to add to that, Erin had mentioned earlier that if you do feel some mild side effects after getting a vaccine, that's a sign that your immune system is mounting a response. So when you get the shot, if you're feeling those symptoms, you're already having that antibody response. For flu, it's typically about 2 weeks until you hit the peak antibody response, but that response does continue and you have that protection going on for several more months after that to get you through the riskiest part of flu season if you were to get your shot right now.
Unfortunately, it looks like we have run out of time today. I want to thank our guests, Will Doyle and Erin Anderson, for the robust and very interesting conversation, an important conversation. You can stay up to date on what's going on at the health department by following us on social media at HOCO Health. And you can also listen to all our episodes at hocohealth.podbean.com, on Spotify, or wherever else you listen to your podcasts. Thank you for listening to the HOCO Health Podcast. We hope you will join us again for a new public health topic.